Good morning, good evening, good afternoon, everyone. Welcome to the June 2019 Fresh School Health and Nutrition webinar. This is Mohini Venkatesh from Save the Children, and I'm speaking on behalf of the Fresh Partnership, which is an interagency initiative that hosts monthly webinars on school health and development in low and middle income countries and locations. Every month, the Fresh webinars focuses its attention on a specific topic affecting children's health and well-being. And this month, um, as we look to life skills promotion, we're in the broadest sense, we have presenters on a multi-level parenting package for life skills promotion in challenged and humanitarian settings. And joining us today to talk about it and the implications it has for a range of different issues, from substance abuse prevention to violence prevention, are two distinguished speakers, leaders in their field. Um, Dr. Wadi Malouf is our first speaker. Wadi is the Global Program Manager for Drug Prevention and Health at the United Nations Office of Drugs and Crime. A bit about Wadi before I introduce our next speaker. Um, Dr. Wadi Malouf is a PhD in mental health and drug addiction epidemiology from the Johns Hopkins School of Public Health. He first um, he began his career in Lebanon in 1998, looking into drug demand reduction strategy. Since 2005, Wadi's been with UNODC, first based at the regional office for the Middle East and North Africa, where he was looking at the drug situation and service response infrastructure um, to define the various drug demand reduction strategies. Since 2012, Wadi has been with the global program at UNODC and has developed, piloted, and is um, assessing the impact of family life skills responses to preventing drug use, crime, and violence through the package we'll hear about today. And he also contributes to the Inspire Interagency Initiative to end violence against children and the WHO UNODC International Standards on Drug Use Prevention. Wadi, welcome to the Fresh webinar. Can I request those of you who are unmuted to please mute yourselves? Thank you very much. Our second speaker is Dr. Ala Elkhani. She is a consultant at drug prevention and health at UNODC and an honorary research associate at the University of Manchester in the UK. Dr. Ala really needs no introduction. She is hugely well known as a researcher on innovative ways to reach families that have experienced conflict with parenting support and training. She's conducted field research with families in refugee contexts and conflict zones in several countries: Afghanistan, Palestine, Serbia, Uzbekistan, Lebanon. And explored what parenting challenges there are and the positive impact of parenting support. Um, and she's contributed to this life skills package we'll hear more about in several different ways. Um, by training, Dr. Ala is a humanitarian psychologist and very well known on TEDx, viewed only by over 1.5 million viewers. Welcome, Dr. Ala. Before I hand over to our speakers, a quick reminder to keep yourselves muted. And if you have any questions during the talk, please feel free to type them into the chat box and do introduce yourself. Wadi, over to you to start us off. Thank you.
Thank you very much, Mohini. Good morning, good evening, everyone who joined us. I hope you can hear me all well. I'm talking to you as we speak from Vienna, from the UNODC headquarters. And I'm really happy to be invited by the Fresh Initiative to present to you the parenting and family work we're doing in the scope of prevention of drug use. But as we see during the presentation, beyond the prevention of drug use, I really endorse the and hopefully to many of you that are hearing. So just to give you a bit of context, the work that we are doing stems from our member states' political will declarations that they have put together in terms of moving forward and addressing the drug situation globally through a General Assembly political declaration that the most recently approved one was in 2016, called Our Commitment to Address the World Drug Problem Moving Forward, where our member states indicated that they want to move more into evidence-based approaches in addressing the drug problem, including balanced approaches from reducing reducing demand balanced with reduced supply. Another important component is the fact that we're working towards the Sustainable Development Goals. Namely, me as a person sitting in the prevention, treatment, and rehabilitation section, which is the health response to drugs, we're addressing Sustainable Development Goals 3. But you will see through the presentation how, while we're addressing this prevention component through an evidence-based approach, we're addressing many more sustainable goals together. We work top-down, bottom-up. Top-down meaning we work with policymakers to make them understand what prevention is, what is the science of prevention, so that service providers would have the chance to work with evidence-based programs. And we work bottom-up, where we actually work with service providers to adapt and pilot on a national basis tools that are evidence-based, to reflect the fact that they are transferable, they're evidence-based, so that policymakers at the top level understand that these are not fictional programs. These are programs can be of use nationally. Can we move to the next slide, please? So basically, we have the international standards that we made reference to. We had the 2013, now we're in the 2018 revision of the standards. We have them jointly with WHO, and this is the tool that makes policymakers realize what prevention is, what works and does not work in the field of prevention. I invite you all, they're available on our website to review them. Next. So this is the SDG 3. We have several targets within the SDG 3 on health, but I wanted to draw your attention that there's a specific target on strengthening the prevention and treatment of substance abuse, including narcotic use, narcotic drug abuse, and harmful use of alcohol. This is no longer just an issue of health response to the drug situation. This is a target that is really intimately linked with sustainable development, and you will understand why in a few minutes. Next, please. So this is a snapshot of what the prevention standards talk about. I mean, there are so many interventions now. When we stop addressing drugs from just looking at the drug per se, and then making prevention intervention that really sort of addresses raising awareness on the harms of drugs, the danger related to drugs. We shift the focus from the drug to the individual, and start looking at the vulnerabilities that exist at the individual level, and then the mental health status, the intellectual capacity, the language development, and other sort of things that are under the skin, and sort of look at the surrounding environment around that individual, the microenvironment, the school, the family, the community, and the macro environment, the kind of the nature where the person lives, the level of violence, the level of drugs presence. All of these interact together in sort of a vulnerability that exists at the individual and environmental level that needs to be addressed. So there are social institutions that can help in different ages of development address these vulnerabilities and accordingly help the child resist these vulnerability and not kind of develop into substance use at later ages. But during development, these same vulnerabilities you can understand are associated with things beyond just substance use. So when we shift and we start working on the vulnerability that we can address through the family, through the school, through the community, and different ages of development, we're helping the child really grow healthy and safe, and then we're helping him on different levels. So I'm going to focus now only on the parenting skills element and the role of family within this context of drug prevention that we're discussing. Can we move to the next slide, please? So in the context, family remains a key institution. Just because, you know, school is an important institution, of course, and plays an influential role in the development of a child. But you can understand the family members, you know, share genes, share a history, share a future together. And then the teacher, for example, has an interaction with the child for a year, maximum 2 years of the life of the child. Whereas the family has a stronger presence in this.
Non, j'ai laissé l'ordinateur même à la maison.
Can you move to the next slide? So another reason why family skills is important is the fact that, you know, there are several evidence-based prevention responses, but we have lots of evidence that when skills in the family are developed, these responses of prevention are gender sensitive. Both boys and girls can benefit from it, which is not always the case with all prevention interventions. Next. Next, please. The first reaction when we deal with family skills, member states, especially coming in as the Office on Drugs and Crime, and we're coming from a drug prevention, family skills, the first issue comes to mind is the fact, listen, we don't have drugs in our family do not like to discuss drugs, so we don't want these kind of programs. But we try to kind of advocate for the fact these programs are not programs that help families really police substance use within their between their members. They are just developing family skills of bonding, monitoring that my colleague Ala will talk about in more details later on. They are just really making family functioning better. Next slide. Most of the programs don't discuss drugs at all. They family bonding, monitoring, and involvement with the children's life, how to have a positively developmental, appropriate, effective discipline applied, how to improve the communication between parents and their children and between parents themselves sometimes, problem-solving skills, conflict resolution. This is the sort of skills we're developing, not skills to detect substance use in their kids and the children. Next. So basically, this is why when you can imagine when like this family functioning is functioning better, you can see that the power of this institution goes beyond just preventing drug use, but it could improve the education level within the schools, gender equality, as I said, because of, you know, they have gender-based responses, and it also kind of reduces violence, which is SDG 16 that is not reflected here, violence against children that we're talking about. You're building resilience in the children for vulnerabilities that go beyond initiation of drug use. You're reducing harsh and inconsistent parenting in the family. These are also directly linked not only to drug use, but scholastic attainment, achievement, delinquency, and poor mental health. So these are, parents are needed in different contexts. Next slide. So these programs, as I said, this is the core content: communication, trust, problem-solving skill, and conflict resolutions. And they provide an opportunity as well for parents to interact with children in a positive way. And then the programs are designed not only to be theory-based programs. It's very hard to learn a skill by reading a book. They are practical in the sense of they're interactive, and you work with the family to sort of practice these skills together. You will see it depends on the context. Sometimes we don't have that luxury of bringing the family and practicing in front of the facilitators. There are several options to do it, but ideally speaking, practicing these skills in front of facilitators are ideal. Next slide. So this is, again, going back, we're not only dealing with drug prevention, we're doing things beyond that. Next, please. And this has been proven in several documentation. There are the INSPIRE initiative, which is an interagency initiative between WHO, UNICEF, UNODC, PEPFAR, and other agencies as well. They talk about 7 strategies of ending violence against children, and you see how family skills and parenting skills are one of these 7 strategies. The WHO Violence Prevention Alliance has evidence in terms of how to prevent youth engagement in violence, and you will see the role of the families, and understandably you can understand the role of the family in that context. And most recently, we have developed also a new tool in terms of prevention of child potential recruitment in terrorist and extremist group, where, like, you know, there are of course way more programs than this, but the family still plays an important role within that context as well. Next, please. This is just to read through the 7 strategies. You will see, if you click on the slide, please, you will see that, you know, the strategy highlighted in green showcase parent and caregiver support as part of the strategies of INSPIRE to end violence against children. Next, please. And this is the Violence Prevention Alliance, how to prevent violence against youth. You'll see that the first of the 7 strategies is parental support. Next. And this is from the new tool of UNODC, where we talk about family support and their role in prevention of potential violence extremism. You will see there's a specific subchapter, chapter C, on prevention through supporting families, which is really essentially providing family and parenting skills. Next. Next, please. Yes. So UNODC has been engaged because we have a reaction saying also most of the programs that have developed in sort of developed countries, where they have a different cultural context of what the family is and what family functioning is. However, this has been dissipated in the sense of, first, for us, theoretical concept, regardless of the cultural values, the need of a developing child from their caregivers is the same regardless of where the child lives. And more, we ourselves are developing evidence from many countries, and you will see from this map, we have 29 countries in different social and cultural contexts where we have demonstrated that parenting skills in different contexts have an impact on, for us, prevention of drug use, violence, and other sort of indicators. And this is a universal construct. Of course, how the program is rolled out will be adapted. If you go to the next slide, please. Of course, the programs are for different developmental ages. We're currently focusing more on the young adolescent age, between 8 and 15 years old. Next slide, please, where the parenting skills are different. We tried the address before got a reaction in terms of, you know, this program is not for us. We tailor the program as we go and adapt it to the local context. Of course, a process of adaptation is needed, but the theoretical construct remains the same. Next, please. This is a slide where we see like what programs is most appropriate for what age, and they go to the adaptation process. I mean, first we do cosmetic changes on these programs before we get a reaction of like, no, this will be changed or not. We try it on the ground, and then by information from the parents and the facilitators themselves, we reach a final decision in terms of what is the final process of the program, not only in terms of content, but the time of the day when the program is rolled out, how to invite, all of this process of invitation, all of it is adapted to the local context, not only the program per se. Next, please. So basically, we went through this whole process and we had lots of experiences, and this is where I passed the floor to my colleague, Ala, where, you know, when we were doing this process, how University of Manchester, on the other hand, was dealing with a subpopulation of families that are of particular interest to us, and then we could take the floor over. Ala, the floor is yours.
Thank you very much, Wadir. Good evening, good morning, everybody. I'm speaking to you today from typically rainy, cloudy Manchester. I'm in Manchester in the UK at the University of Manchester today. I'll pick up from here, Wadia. Thank you for that. So there are a number of evidence-based family skills programs that are commonly used in high income and stable contexts. So, you know, a simple Google search, you know, you will find some really, really successful family skills programs that have been very well adapted to different contexts and different cultures, and through the process that Wadia just described on the slide before. Now, the question that we had at Manchester with colleagues, namely Professor Rachel Calum and myself, was that could family skills programs be applied to humanitarian contexts? Because when we started this work about probably 6-7 years ago now, there were no family skills programs that were specifically aimed at humanitarian contexts, that were open access, that were suitable. Next slide, please. So 1 in every 113 people in the world is a refugee. Now, if we take a moment to really reflect on that number, I mean, that is vast, that is worrying, that is scary. And it's these kinds of people that are often the ones that are forgotten the most. An estimated 1.5 billion people in the world live through armed conflict. Almost 1 in 10 people in the world have an experience of living through conflict. And the current refugee crisis is the largest humanitarian crisis of our time. You know, the news, any old news report will show us images of Syria, of Afghanistan, of many countries in Asia that are currently experiencing conflict as well. And families that experience conflict face multiple challenges. The mental health and functioning of these families is very, very important for prevention. And that's really where we come in with our family skills programs. We come in at the level of prevention. Now, the quality of care that children receive in their families can actually be more significant as an indicator of their mental health outcomes than from the actual experiences of war. So if we try to kind of really focus on what I just said there, the parent or the primary caregiver can actually be kind of a protective shield, or can actually further complicate war stress when they themselves are dealing with their situation badly. And if you think of yourself as a caregiver, I mean, how are you going to cope? It's no wonder that caregivers will be kind of experiencing war as a challenging circumstance for themselves. And children that have experienced conflict can be protected by warm, secure parenting. Yet parents or primary caregivers are often ignored in the cycle of care. When there is funding in this context, it will usually go to what's deemed as a primary need, which is food, shelter, education for children. But caregivers are almost always ignored in where funding or where attention is going to caring for children. Next slide, please. So myself and colleagues, Professor Rachel Calum, namely, as I mentioned before, have been conducting research in refugee camps in Syria and in Turkey, kind of working on understanding what challenges families in these contexts would be having. So much research was conducted over about a 3-year period in Syria and in Turkey along refugee camps between the borders, trying to understand what families might be experiencing, how they might be coping, what they were finding as challenging in this situation in looking after their children. What we found is that families affected by conflict really struggled in caring for their children. And that's no surprise. They watched their children change in their behaviors and in their emotions. We saw many reports of children bedwetting, thumb sucking, children becoming far more aggressive, far more withdrawn, and parents having absolutely no idea how to deal with these situations or where to get support from. I also met families who were themselves dealing with huge emotional challenges as a parent and a massive sense of loss of control. Caregivers had to deal with these challenges that they were seeing in their children and of the really scary times that they were experiencing themselves, and then also still having to deal with looking after their children appropriately. But then what is deemed as appropriate? How are you going to know how to care for a child when you've just experienced war or conflict or you're living in a refugee camp? Parents said that they were making significant attempts in accessing support and advice, yet sadly on almost all occasions there simply was none available. The need for caregiver support in caring for their children was simply not prioritized or not funded. The lack of availability and the use of family skills programs in such contexts is really namely due to the programs consisting of multiple sessions. So programs often were really heavy on how many sessions were needed, on how many materials were needed, very costly. They were aimed at facilitators that had really specific backgrounds in psychology or child education. And this was something that was very rare to find for families or for facilitators in this context. Next slide, please. So in response to this identified gap, we at the University of Manchester have been working along with the UNODC now for several years in developing and implementing family skills open resource information that can be accessible, open access to meet this need. And that's really where this key point comes in, open access. So we're trying to get away from all the really costly programs, the multiple session programs, the ones that are far too heavy for the humanitarian context to hold, and allow these programs to be accessible, open access. So we've developed some work around this model that you can see of family multi-level parenting support delivery for families living through conflict and displacement and other humanitarian contexts. So here at every level of this model, families can access support depending on how much resources the area that they're in has and how much need they have. And I'm going to take you very briefly through each level and each resource. So the bottom here in yellow is our efforts in the development and the distribution of a parenting information leaflet for families that were living in a conflict zone in Syria. Next slide, please. We conducted a unique trial in which we developed a parenting information leaflet. We conducted the bread wrapper study, which posted 3,000 urgent parenting advice leaflets and questionnaires to families living in Syria, living in a conflict zone in just 2 days. So our previous research really showed us how great the need was for families to have information. So we thought, how can we reach families on a really high level, a very universal level, with information fast in a very rapid form? So we kind of piggybacked onto an existing humanitarian supply route of bread that was being delivered to families inside a conflict zone in Syria through an NGO that had a bakery. And it was this way we were able to distribute these 3,000 parenting information leaflets to families. Next slide, please. Leaflets explain the different types of behaviors children might be experiencing as a result of the exposure to extreme violence and loss. They were helpful tips on providing warmth and safety, things like giving praise, spending time talking to your children, encouraging play, trying to maintain some kind of routine, as basic as that might be. We also distributed a questionnaire attached to the leaflet, which was asking caregivers how their overall response was to this caregiver leaflet and how useful it was. The leaflets and pens were wrapped in packaging for bread and delivered by this NGO. Next slide, please. We had an astonishing 60% almost response rate. So almost 60% of caregivers living in a conflict zone returned the questionnaires. And this really highlights how important these family support messages were to families, that they would, in this kind of context, make an effort to respond almost 60%. Now, if I delivered 3,000 information leaflets in Manchester to do with parenting, believe me, we would not get a 60% response rate. So to have this in a conflict zone really, really is astonishing and really highlights how important these kind of messages were to families. Over 80% of the internally displaced caregivers rated the overall usefulness of the leaflet as quite a lot or a great deal. Oh, next slide, please. So yeah, as you can see, next slide, please. Yes, over 80% of the internally displaced caregivers rated the overall usefulness as quite a lot or a great deal. And caregivers left really moving information and comments on how they experienced this leaflet. Things like, thank you for not forgetting about us and our children. I've been waiting for some information on how I can look after my children. I now have it. And this leaflet now has been adapted to the European refugee crisis and has been translated and is used globally now in several languages and can be downloaded online. The Swedish Refugee Response Institute uploaded this leaflet onto their website, and they had the highest response ever for any information on their website in their institution. And again, they were astounded at how much need there were for people to have really basic parenting information in this context. Next slide, please. Now, the next level up of our model in green takes us to areas where we have more resources and the environment is slightly more stable. Here, in response to families requesting more information in our bread wrapper study, we developed a light touch intervention that consists of two things: a parenting booklet and an associated conversation group seminar. Parents receive a booklet demonstrating key parenting skills, kind of like the information leaflet, but more expanded, more extended, more information given, and engaging, information such as building parental confidence, self-regulatory skills, and enhancing child and family psychological well-being. They can take part in a 2-hour conversation group, discussion with other caregivers. Next slide, please. We conducted a randomized control trial with 119 families in the West Bank, Palestine, not long ago. And we conducted a study in which we had two groups. We had a intervention group who took part in this intervention, and we had a wait list who took part in the intervention at the end of the study. And what we found was, next slide please, that both groups' results showed a trend in reduction in both child behavior problems and an improvement in parenting and family adjustment over time, and seemingly more so for the intervention group compared to the wait list. Now, the fact that the control group themselves showed an improvement indicates the advantages of simply engaging families in conversations about parenting and family struggles. And the results of this study have recently been published, and we can add a link at the end of how you can access this article too. Next slide, please. Now, the next level up of our model in orange is the multi-session family skills intervention, Strong Families. And I'll let Wadia take over and describe that to you.
Yes. So you can see, thank you, Ala. And you can see, why we were interested in supporting the work that University of Manchester was doing in the work. We said, not only in terms of research, we're interested in this and opening the doors in terms of where we can pilot these initiatives, but we were piloting evidence-based programs before for a period of almost 9 years. And as Ala mentioned, most of the programs we were addressing in the context of changing the culture of prevention, like evidence-based prevention is important. So we were importing evidence-based programs that exist, but these programs have been designed in developed countries, where the infrastructure where we're working is not the same. So we added to this process in the sense of, why don't we develop, we were considering development of open source programs that are also interactive to add to this arsenal. Strong Families program was prioritized as a family skills program that is designed for families living in conflict and challenge settings. If we go to the next slide, please. The program is designed as a 3-session program. The first session is about 60 minutes, which is only for caregivers. And the two next sessions are for the entire family. 60 minutes are in parallel between the parents in one room and the kids are in another room. And 30 minutes, the family comes together. So they're designed for families that have kids aged 8 to 15. They aim to improve child well-being and mental health, and of course, moral situation in order for avoiding several negative social outcomes. The overall context is like a 4-hour session, the whole program, 1 session per week. And the program is designed to be light, in the sense of the people delivering the program are not professionals in any field, but they have good relationship with the community. They're good facilitators, and when they're properly trained on the session, can deliver these programs. There's also a brochure about this program. The link is there, but we can also avail it to anybody who's interested. Can we go to the next slide, please? So the program, just to give you an idea in terms of the caregiver session that I'm talking about, they explore parent challenges, develop ways to better deal with stress, value of setting both love and limits, listening to the children, how to encourage good behavior and discourage misbehavior. This is what the sessions of the caregivers focus on. The children's sessions, how to deal with stress, how to explore rules and responsibility, think about future goals in addition to the important roles of the caregivers. And then the family session comes and like puts everything together in terms of positive communication, practice stress relief together, and the like. You see, like there is lots of context of stress because this program has been designed for families living in challenge settings, refugees, displaced, rural areas, in conflict, post-conflict settings. That is why, I mean, of course, parenting is the same more or less at a certain age, but the context of stress and stressful situation has been emphasized and how to deal with stress and recognize stress in most of the sessions. Next slide, please. Yeah. So basically, when we were with this program, because it was designed as evidence-informed, we have tried to pilot this program in different settings. We were fortunate first to develop it and implement it in Afghanistan, which is a challenging setting in more than one level. And we had about 72 families that first benefited from this program, about 50-50 split between children that were boys and girls. And in 3 different cities in Afghanistan. But in parallel, we had the chance also to be able to pilot among refugees that were stranded in Serbia. Coincidentally, they happened to be Afghan refugees. So we sort of had the chance to kind of measure these 100 families that were either internally displaced in Afghanistan, let's say, or in refugee settings in Serbia, in Southeast Europe. We have measured the families before taking the program in the context of their background, who they are, their structure, how many, what the age of the parents and stuff. These are just demographics at baseline. And at baseline, we had 2 tools that we have used to measure either the strength difficulties that the parents feel with their children, which is the questionnaire called the SDQ. And then we have another tool that measures parenting and family adjustment. These 2 tools, 2 and 3, were measured at baseline, 1 or 2 weeks after the intervention, and then 5 to 6 weeks post-intervention to see how much this program is helping the parents, either in the challenges they face with their kids or in their parenting and family adjustment. Next slide, please. So here you will see in contrasting, first of all, this is the SDQ. The rating is in very high, slightly rates and close to average compared to a normative population in terms of when the scores are very high, they reach almost sort of clinical level of problematic situation with the kids. Understandably, you can see that kids that are more or less within the orange to red zone at baseline in terms of assessment with their parents. The advantage was that over time, in both circumstances and both contexts, both families have reduced their rating in terms of problematic rating of their children over time, almost to a normal level, and there's a retention over time of that improvement. Next slide. We have focused particularly when we looked at the parents that rated their child as very high, both in Afghans that are refugees or in Afghanistan. Also, that change has been particularly noticeable among those that rated their kids as particularly problematic at baseline, which is also something that is comforting and important for us. Next slide. Then we try to see if whether we have gender sensitivity of the response, and also both boys and girls have improved their ratings. Their parental rating have improved over time on the total score of the strength and difficulty questionnaire from baseline to time 3, which is also something very important for us to in our gender-based response as United Nations. Okay, this is in Afghanistan. Next slide. Since then, we have started expanding the pilot to different settings. This is just a few slides to show you like the faces of the people we're working with. Next. But also we're working in Zanzibar, in Uzbekistan. So basically in Zanzibar, these are 2, we're working in communities that are in rural settings. Next. So basically in the last 2 years, when we started, the program has been developed since 2 years. Now the program is available in 10 different languages and is piloted in 12 different settings. Next slide. That's about the Strong Family program. You will see the difference. It's a bit more interactive. There's a facilitator that comes work with the families and parents and to teach them the skills and work with them, which is, if the circumstances allow, even a step forward to the parenting booklet and seminar that Ala mentioned, and the leaflet. And I leave the floor to Ala to talk about a different need when there's trauma in the family, how to deal with trauma, which is the TRT plus. Ala, the floor is yours.
Thank you very much, Wadia, for that really, really good description of strong families. I'd like to just kind of focus a bit more on strong families before I move on to continue. I'm one of the trainers for the Strong Families program, and often after we implement in a country and then we have fantastic results, and then we start analyzing, Wadia just shared a lot of the quantitative work with you, but it's the qualitative, it's the interviews that we conduct with families after that really are so moving. I mean, recently I was analyzing some interviews from the implementation in Serbia with the Afghan refugees, and the comments and that the families had left were really moving. Some things such as how important it really is for your child to now start to listen to you in context of danger. What it feels like for a caregiver, for example, to suddenly feel like they have a bit more control over their life, to suddenly understand what it is that they now can do to help their child improve their situation, to get their child to comply with them. How do they maintain a kind of a routine or positive communication within their families? So I think sometimes it's nice to reflect too on the fact that these are humans, they're not just numbers. And I think we're very lucky in the research side that we get a chance to go back and talk to families and ask them how their experiences were too. So I just thought I'd like to add that as well on how the comments and the feedback we get are so hugely rewarding and encouraging, which is why we're pushing ourselves to take strong families as far as we can. Okay, back to this model. And if we are now at the kind of the top level of the model in pink. And the sad reality of humanitarian settings is that many children will need more specific tailored trauma recovery support. We have kind of universal approaches, but some families will need more help. Children that have been through trauma can often have high levels of post-traumatic stress. So what we've done at the University of Manchester, next slide please, is worked with the Children in War Foundation, which is a Norwegian-UK collaborative group, to enhance their existing evidence-based child recovery program called Teaching Recovery Techniques, TRT. Now, the original TRT program is aimed at children who have high levels of post-traumatic stress. And the original program has 5 sessions just for children. And caregivers do take part in 2 parent support sessions, but these in the original program are really just about kind of making families aware of what kind of trauma recovery work their child will be doing. But based on the research that we did at the University of Manchester and our collaborative efforts with UNODC, we felt that it was important to kind of see if we could adapt this existing TRT program and add a whole stream of caregiver support sessions too. So what we've done is we've developed an enhanced version of this original TRT program called TRT plus parenting, in which children go and attend 5 trauma recovery sessions, but then caregivers also take part in 5 caregiver support sessions too, where caregivers learn how to deal with challenges, how caregivers enhance their family functioning, their well-being, how they deal with behavior and problems, and how they develop their own parenting skills too. So over a 5-week period, children attend these sessions, but then caregivers do too. Next session, please. Next slide, please. Now, a pilot of this enhanced plus parenting version of the TRT program was conducted in 2015 with Syrian refugees. And we did this in a town along the Syria-Turkey border, which had a massive number of Syrian refugees. And the outcomes were hugely promising. We found reductions in signs of distress in children and really increased parental confidence and skills. And we've now published this piece of research. So if anybody wants to have a look at it, the link is there as well, and we can add it as well. Kind of encouraged by the results of this pilot program, we then went on to conduct a 3-arm randomized control trial with the United Nations Office on Drugs and Crime, with Wadia and his team, with 119 Syrian refugee families living in camps in Lebanon. We compared the original TRT program, which is just child trauma recovery, with the TRT plus parenting version, and compare it to a control group as well. And the results have been hugely positive. Next slide, please. If we look, for example, at this measure, it's the CRIES measure. Next slide, please. The CRIES measure, it measures 3 aspects of child stress post-trauma: intrusion, avoidance, and arousal. And what you're looking at here is the intrusion component. The green line is the wait list. The blue line is the families that took part in the original TRT program, so just the child sessions. And the red line is those who took part in the enhanced TRT plus parenting sessions. You can see that all 3 showed significant effects, with significant interactions and with the greatest reductions in the TRT plus parenting group. Next slide, please. We similarly saw this effect on all the child and the caregiver mental health measures, such as this screen for child anxiety-related disorders, both when self-rated by the child, as you can see on the left, and also when rated by the caregiver on the right. These results hugely encourage the TRT developers to now begin to explore actually using the TRT plus parenting version as their standard. And we're now working on them on developing a new manual that will be available for all trainers now. Next slide, please. Oh, here we go. Wazir, you can take over here. Thank you.
Thank you. And then, of course, aside the families living in challenge settings, we work with families living in low-income countries in general, but not necessarily in humanitarian settings. We are developing, as we speak, another program has been developed. It will called Families United, which is universal in nature. It will be implemented first in Indonesia and Bangladesh. Actually, tonight, myself and Ala and Professor Kalam are going to Indonesia to train Indonesian and Bangladesh facilitators on this program for the first time. Next, we will keep you posted of its results. Next, please. So basically, it more or less has similar interest in the sense of the parenting and child and family session that it incorporates, but of course it goes wider in the sense of the parenting skills that need to be handled within these contexts. It's 4 sessions long, and we can share with you a small brochure about this program as well. It's a program in development, but conscious of the time, I will not go into too much of its details, but go to the next slide, please. Yeah. So the message is parenting is prevention. So when we're working on parenting skills, these are essential things to have in order to have good, healthy development of children in different contexts. But we have particular interest in helping those that are living in the most vulnerable situation. They can be done in challenging and with poor infrastructure that are available. Ala mentioned her experience in terms of something as simple as a leaflet. So let alone actually somebody passing the information interactively when trained on the material. Most of these programs, I didn't mention that, but the recruitment of families to come and benefit from these programs is done in schools. So we invite families through schools to get the age of group that we're looking for. We implement these programs in the classrooms after class hours. And this brings the family and the schools closer together as 2 influential social institutions in the life of the development of the kids. So they're very powerful in terms of addressing these vulnerabilities. And again, I stress on the fact that these programs go beyond just drug use and they improve education, they improve violence. They can be implemented in different contexts, different countries, something that Ala passed by really sort of quickly, but you probably will see it in the slide if you go back to it again. Ala, when she was training on TRT+, she trained the facilitators that were reaching to the Syrian refugees in the Bekaa in Lebanon over Skype. For security situations, you cannot fly over there, but she managed to do it remotely. That will tell you about the flexibility and reach about how you can kind of reach these programs regardless of how difficult it is, as long as you make the programs simple and enough to be to reach its target destination. So we all have a role to play to make a better world for the children and the families. And that's the main message that we want to send to you. And I will leave some room for questions now.
Thank
One
you
more.
so much.
I need to recognize Professor Kalam, who's not here, Professor Virginia Molgar, who will help us in development. And I see my colleague Karen Har is online, and she's responding to some of the questions. She helped us a lot on the analysis. Sorry.
Thank you. Thank you so much, Wadi and Ala, for that excellent presentation on the multi-level parenting package that you took us through. And it's fantastic to see the different levels at which interventions can be implemented and with results, because this is something one always gets asked, and one questions of what has been the impact of our intervention, and your work and the rigor that you've brought to it has a lot for all of us to learn. And for those of us who work in the field of school health and nutrition, and we know that what we do at schools for school-age children is not sufficient in itself, we need to reach out to parents. This gives an excellent example of how to grade the outreach for parents, for families. So thank you for all of that information, and congratulations on your work. We don't have much time, so I will keep it to a couple of questions. There was one by my colleague, Jeannie Long, about a very different context, and I wanted your thoughts on that, and how you would encourage folks to approach such a situation. So Jeannie asks, can you speak more about how the interventions work in contexts like El Salvador, where gang violence is entrenched in everyday life? Many youth and adults are associated with gangs. Parents are afraid to send their children to school because they're being recruited in gangs. How does this intervention work when parents might be in a gang? Are there instances of retaliatory violence against parents who are involved in these activities?
Well, just to give you, if I may, we have not created this specific program in El Salvador. However, we are engaged in El Salvador. As I said, we have been, before the development of these programs, we have been piloting family skills in different settings. There's a program called Familias Fuertes, which is a Latin American adaptation of strengthening the family program 10 to 14, SAP 10 to 14. We have already piloted that program in El Salvador very positively. And I do agree, the program that has been, while we were approaching it from a context of drug prevention, the program has been absorbed by the government as Youth Gang Violence Prevention Program. It has been piloted successfully in El Salvador. And the government has an affinity to kind of scale up for more. It is feasible to do it in these contexts. Of course, we are working in kids, we're recruiting kids that already are in school. The experience is positive. We can share more details about it. And we're currently also adding life skills education within these schools to build resilience in the skills in the kids themselves. If interested, just communicate and we'll send you all the information with regard to our experience in El Salvador. And we have a specific publication on the impact on violence, specifically on the application of family skills in El Salvador.
If I can just like to add to that, I think it's really important how we sell the program. So we try to kind of avoid any mention of drugs or alcohol or anything that could be worrying to any groups. We try to sell it as it is, which is to support families in better caring for their children, having better outcomes. So I think what we focus on a lot is first of all, recruiting the caregivers themselves and really having them engaged. You can't actually conduct these programs without the caregivers themselves being fully engaged. So again, doing practical things like offering incentives that are culturally acceptable, that are very open, really, really helps as well to get families on board. And we also did some research in Panama recently, and we found that actually the community completely bought into the project, and we're encouraging each other were telling their neighbors about the sessions that they were taking part in. So I think though it can be more challenging, if caregivers are sold, as in if they are engaged well, I think you can have really positive outcomes for communities.
Thank you for that, Wadi and Ala. We're short on time, so just one other question, and I'm just going to combine a few questions into one on measurement. And if you can, in a couple of minutes, just speak to how do you, one, assess risks in terms of children having the propensity to get to engage in drug abuse, and if there are tools around that, any standards. Secondly, about the hard evidence that shows family communication or the lack of it can relate to the engagement of youth in violent extremist groups. And as you were saying earlier, these programs are run as generic family support programs. So how do you tease out the effect or the impact it's had on substance abuse reduction? And thank you to Caroline and Kalenzi for those questions. Over to you.
I will just start, and I leave some room also for Anna to respond. With regards to application of these programs, it is important to know that these programs are implemented universally within the settings where we're implementing it. We don't look at the propensity of, we don't filter, we don't have a filtering mechanism of selecting special kids versus the others. We look at the developmental needs of kids within a specific age group, and we provide the program to all kids. Now, this is an important factor. Yes, there are some programs that require to be indicated, like problem kids that already have showcased a specific level of risk and requires a different programs in place. These programs, for example, Strong Family has a specific criteria. If you have severe problems with the kids, this program is not for you. So when we're applying these programs, these could be filtering to refer the kids to other sort of services that exist at the community level. So the programs are universal selected in the sense of we provide them for everyone. Needless to say, when it comes to violent extremism, I did not mention that this program is like the program for dealing with this, but it contributes to it. You see that the tool has several different sort of contexts to deal with prevention of violent extremism. But I just mentioned the fact that when this program is applied universally, it contributes to that strategy, but the strategy, when it comes to different strategy, is more wide than this specific program. I really hope I with the brief time, I covered it, but we can discuss. Anna, you might want to add something?
I just wanted to add very quickly, if you'd like to search Michael Unger, I just wrote his name here. His group in Canada deals with a lot of really good measures if you want to integrate things to do with terrorism or violence into research and into tools on this area. So do have a look at the group that Michael Unger leads at the Children and Youth Refugee Research Coalition in Canada.
Thank you. Thank you, Ala. Thank you, Wadi. I will wrap up now, but I first wanted to thank both our speakers and all our participants for attending today's fresh webinar. And we were commemorating the International Day Against Drug Abuse and Illicit Trafficking that's coming up later in June. We will continue the conversation on youth skills next month on the 16th of July, which is a Tuesday. We'll be talking about child-friendly schools and commemorating World Youth Skills Day. Do look out for the invite on that. And the presentation from today and the recording will be available on the sites mentioned in the chat box before, the Fresh Partners site, the HIV and Health Clearinghouse from UNESCO IIEP, and the Resource Center at Save the Children. And if you have any questions, do reach out to our speakers or write to me for linking you with with any of the other participants today. Thank you so much, and have a good day and a great weekend. Thank you.
Thank you, Mohini, and all.